Hello everyone, we are Group 11 and we will be presenting on topic Lean, Balancing Efficiency and Sustainability in Healthcare. I am the group leader, Omayemi, and alongside Chaminda, Rita, and Vinod. The aim of this project is to analyze the impact of the adoption of Lean on a service sector-based organization.
Thank you, Omayemi. Now, let's look at the historical perspective of Lean methodology. The origin of Lean management dates back to the late 1940s. It was developed by Toyota as their operating model called Toyota Production System. After 1945, it departed from traditional mass production. A turning point in 1950 led to the concept of Lean production after O'Neill and Edge's visit to Ford factory in America. The adoption of Lean system increased from 1973 and became introduced into other sectors like the healthcare in 1990. The interest in Lean production decreased in 1997 and in 2015 led to the introduction of Industry 4.0. Please, the next slide. Now, let's have an overview of the origin of Lean Toyota production system. The first concept is the just-in-time is the core principle which introduces only what is needed and when it is needed. The main aim of this is to eliminate waste. The next is a continuous improvement, which is a culture that enhances efficiency and quality. The third is respect for people, which empowers employees through engagement. All these aim to reduce costs, maximize profit and quality from customers' perspective. Please, the next slide. At the core of Lean system are value streams, flow, and pool. Lean examines value from the customer's perspective. Now, when we look at the Lean stream is a key as a step to deliver value are usually mapped and analyzed. The flow must be seamless, while the pool system ensures that the production is only in response to customers' need.
Thank you, Rita. In this slide, I'm going to talk about the introduction to Saint Mary General Hospital. It was founded in the year of 1924, Kitchener, Canada, and it was founded by the Sisters of Saint Joseph Hamilton, and it is the world's second largest acute care in the Saint Joseph's health system, and it has an bed facility around 500, and Saint Mary Hospital has been the leading healthcare facility in the Canada and it has been serving the community around for 50 years, and it has a staff quantity around 2,000. So which they got an option to renowned physician and experienced nurse and specialized staff support, which is ultimate gain to support the patient care, and they have a cutting edge technology. They have implemented robotic surgical systems, and they have implemented the telehealth capabilities, which the patients can get a doctor through mobile phones, to the internet, and they ensure the patient's healthcare at the primemost. Next slide, please. So, why Lean is important for Saint Mary Hospital? Regarding the it is a vast hospital which is running over through a century. It faced the challenges in the common healthcare, the long waiting times, and inefficient support processes and resources. Lean principle can address them in the streamlined workflows and eliminating waste and empowering the staff to improve the process, which has been divided into three: reduce waste, improve efficiency, enhance communication. Next slide. The process for the Lean implementation in the Saint Mary Hospital is for around a four process: stakeholder engagement, process mapping and analysis, pilot implementation, continuous improvement. In the stakeholder engagement, the Lean, that strategy that have to engage with the hospital frontline staff and leadership and the patient representative, which will make a collaborative state. They can implement the lean and process mapping and analysis. So in that, they will be making an value stream mapping, which is a detailed mapping around about the lean, which can be implemented through the lean, and they will be finding the bottlenecks and what are the disadvantages of without a lean, and opportunities for streamline workflows and enhance patient experience. Uh, these will be found by the 7 stages and pilot implementation. The pilot implementation, this is a process where the lean principle will be applied for an specified departments, which can be an test. So they can go through and they can implement the lean after the strategies across the entire organization and continuous improvement. This is also called a kaizen, because this is a continuous improvement in the lean, because they will be improving the getting the feedback from the patients, which can improve the hospital's state, and it is an employee empowerment that can that ensures that lean is providing the proper health and wealth and proper support for the employees. Next slide, please. So in the value stream mapping at the current stage, it has we have found around the three major factors. The ER waiting time for a patient is around 4.5 hours, and per patient the cost is around 1,200, and the overall employee satisfactory rate is around 55%. So we propose 2 models for these strategies. One is a PDC cycle. It's around a 12 process and quarters 8 change model.
Thank you, Vinod. So in this slide, so basically we are talking about waste at St. Mary Hospital. So at the St. Mary General Hospital, we found some serious insufficiency in their current practices. So example, patients were waiting for 4.5 hours for the treatments. So dealing with unnecessary paperwork and tests. The staff were constantly moving around more than they need to. So there was a lot of waste inventory and proof of transportation of supplies. So these issues lead mistake like using wrong equipments. So we categorize the problem using 3M framework. So MUDA is the waste, MURA, uneven work, the MURI, overburden. In simple terms, this means too much unnecessary work, inconsistent workload, and stress out of staff. Fixing these areas is crucial for improving patient care and helping to the hospital run smooth. Next slide, please. So in this slide, we are explaining about value stream mapping in emergency department. The diagram shows flow of patient through the emergency department, starting from their arrival with care needs, all the way their departure. Each step, like triage, registration exams, and lab work, has specific cycle time and some of waste times. Next slide. In this slide, we are focused on bottleneck, which is lack of information storage and data exchange within St. Mary Hospital. The fragment data storage, lack of interoperability, and manual process contribute to inefficiencies that ultimate impact for patient care. Next slide, please. So after doing value stream mapping, we have identified a big issue here. Is the bottleneck at the dashboard where lab information and patient status need to be entered. This delay in data entry shows everything down. In total, the lead time is about 160 minutes, but only 46 minutes are actual value added care for time for the patients. The main problem in the emergency department are centered around low wait time and inefficient triage process and overcrowding. Patients were waiting way too long, which led frustration and even put some people health at risk. So the triage system wasn't well organized. The causing delays getting treatment, especially for those who need urgent care. The overcrowding made things worse, with patients stuck waiting in hallways or the temporary areas. Some of the other big issues we identified, including outstanding process and inefficiency of use of resource, like equipment and the schedulings. There was a lack of collaboration between teams, which led miscommunication and missed opportunities to improve patient care. And lastly, discussion making was often the ineffective. There wasn't enough data to guide improvement. On top of that, the patient satisfaction is taking a hit. As people are frustrated by the slow process and delayed care, the fixing the bottleneck is essential to improving the overall experience and making the department run more smoothly.
Thank you, Shaminda. Starting with the challenges arising from lean implementation at St. Mary's, we identified employee resistance being due to the changes in workflows and also increased workload from lean implementation. This led to a reduced morale and productivity among staff. Also, the lack of required executive support. This is due to the absence of executive support, and this makes it difficult for management to get the required approved budgets needed to implementation of lean, and also extra cost as a result of possible implementation of the infrastructures required for lean adoption, and also the procuring of vendor lean training for staff members. Data overload was also seen due to lean itself. It's a data-driven decision-making process, and also the reliance on paper documentation by frontline staffs was an impediment and a challenge for the adoption of lean. Also, the lack of flexibility due to sticking to the traditional means of operation by frontline staffs also acted as a challenge for frontline staffs. In terms of sustainability, it was seen that 20% of the initiatives that were introduced early on actually regressed after 6 months. This created a need for an improved team focused on ecosystem-friendly and expert engineers to maintainers. In looking at the mitigation strategies for these challenges identified, we have seen that to curtail employee resistance, there was introduction of staff engagement by adopting training for staffs to improve the work culture on lean and improve awareness around lean culture. Also, the need for clear communication channels. So clear communication channels were adopted for us to actually address concerns and increase the buy-in of staff members, and created an opportunity for them to troubleshoot any concerns that had been raised. Also, the lack of executive support was addressed by the adoption of the Gemba work practice, which is simply a practice whereby executive management actually come to the front line to actually see the continuous improvement culture actually in operation. This was able to convince them, and they actually give their support, and with their support, the required budgets and support for initiatives of lean are easily approved. In terms of extra costs, to further reduce costs, a cost benefit analysis is done to assess the impact of the initial investment and thereby manage these cost related areas. Training of internal employees will also help to reduce external costs from taking on external consultants. Also, in terms of reducing data overload, there was focus involved in data reporting to streamline the current format of reporting, thereby also providing training for staffs on the metrics that were needed to be reported. In improving flexibility, lean processes were also adopted, thereby accommodate also exceptions from staffs, to also develop standardized protocols which can easily be followed by frontline staff. On sustainability, a sustainability culture was also encouraged, which will further improve these initiatives of lean. And also, a lean champion was also appointed to monitor, sustain, and advocate for the progress of lean across diverse units in the hospital. In conclusion, we have seen that the reduction of waste and maximizing value across all operations by also utilizing value stream mapping, we have been able to identify inefficiencies and streamline workflows, eliminated value-added activities, and also bottlenecks. This will help reduce the waste and also further improve in terms of time management, the resources, and also processes, which will further impact the bottom line, which is the patient, and thereby giving improved quality of service. In recommendation, in addressing some of the issues earlier identified, in terms of data storage, it's recommended that there's a need to implement a centralized electronic healthcare system, which will help in the reduction of being reliant on paper-based, and also digitize records of patients, and also create easy access to data sharing. Also, the adoption of a cloud-based storage will also facilitate the easy storing, recall of stored items. The lack of interoperability will also be addressed using software platforms like HL7 to enable smooth data exchange between departments. It will also help in collaborating with vendors by integrating systems between the hospital, St. Mary's Hospital, and the vendor interface to also allow for seamless exchange of data and also others. In also improving manual processes and also by automating these processes to make a seamless workflow. The automation of these processes using these EHR platforms, the electronic health record platforms, will also make the workflows of between frontline staffs and the middle office seamless, and also help in digitizing the workflows by the use of electronic documentation. Thank you.